Well, good morning, everyone. And thanks for waking up with United Way today. I'm Efrat Pfefferman. I'm the Executive Director of United Way of Monroe County, which works to meet our most critical needs in Monroe, Owen, Greene, and portion of Brown County, addressing those needs today and reducing those needs tomorrow. And the Wake Up with United Way series this year has been focused on building a better normal. So, as we're rebuilding from the COVID pandemic, what lessons do we take into the future? What adaptations and innovations and collaborations worked well that we need to make sure are in place so that we don't return to normal, but we return to a better normal when this is all behind us. And this month we're delighted to have this panel of speakers, which Mark, our friend from PACE, is going to host in just a moment. But before I turn it over to Mark, I just want to give a big shout out to Wake Up with United Way's series sponsors. While this series is a collaboration between United Way and IU's political and civic engagement program, it would not be possible without the sponsors. We've got Bloomington Township, our premier series sponsor, our presenting sponsors, IU Credit Union and the Community Foundation of Bloomington, Monroe County, and program sponsors Duke Energy and Old National Bank. Let's give them a big Zoom hand. And with that, I'll turn it over to you, Mark. Thank you.
Excellent. Thank you so much, Efrat. And we are really excited about the panel that we're having today. We're going to be talking about some of the intersections of health and safety and talking about the ways that health and safety issues can lead to a thriving community. And so we have with us, a very great group of folks. We have Liz Grenat with Community Voices for Health and also from CJAM. And we have Melissa Stone with BPD and Penny Caudill with the Monroe County Health Department. And so we're going to be talking about a lot of these issues of public health and public safety, talking about the ways that these are created, how are we going to be able to think about public health in a broad way, and what are some of the steps that we need to be able to make forward, to move forward, right? So we've been thinking about health a lot lately. We've had this pandemic over this past 16 months that has really altered our lives in a lot of different ways. But we also know that health is something that is much deeper and touches so many different angles of our regular livelihoods and our way of being as a community. And so we want to kind of unwrap this and then also unpack this a little bit and see about some different ways in which we might be able to take some action or have some sort of positive impact in improving our overall community health. So with that said, for those of y'all who have been with us in different times in the past, you may know the drill, but we'll get started having a discussion among our panelists. But if you want to join the conversation, please do so. You can feel free to talk in the chat as you want. And if you're still just getting in here, remember to introduce yourselves in the chat, so that folks know who's here, who they're attending this event with. If you wish to ask a question to one or all of our panelists, please do so through the Q&A function, and we will make sure to get to as many questions as we possibly can, given the constraints that we have with us. Just stating again, the sponsors for this event are, the sponsors for the entire series are the Bloomington Township, IU Credit Union, Community Foundation of Bloomington, Monroe County, Duke Energy, and Old National Bank. That being said, I am now going to go to our panelists. So I'm going to start a little bit with, so I'm going to ask all of the folks on this panel, to be able to introduce themselves and state a little bit about, some of their role, especially as it plays with the intersections of health and safety, and talk a little bit about some of the broad picture outcomes of health and safety in our community. So I'm going to start with Liz, if you want to introduce yourself and tell us a little bit about what CJAM and Community Voices for Health are doing.
Good morning, everybody. Really honored to be here to talk a little bit about CJAM and our newest initiative, Community Voices for Health. And so kind of people may be sitting here thinking, why CJAM on this conversation of health and safety? And so what we know and what research shows is that before any community can be truly equitable and resilient and healthy, they must be safe. And we do know that when conflicts are left unresolved, we see growing stress, tension, harms that oftentimes can never be repaired. And sometimes we see, devastating violence that results from those unresolved conflicts. I think today, even in the newspaper, there was a report of a shooting at Crestmont Park as sort of an example of what happens when people don't have the opportunity to really come together and resolve those issues. And we know that exposure to conflict and is expensive. It increases the likelihood of family instability. It causes mental and physical health problems, legal issues, and it literally can break down to lead to the breakdown of communities. So our mission at CJAM is to promote a civil, a safe, and just community by providing mediation, education, and restorative justice. And sort of our overall vision is that we, want to see our community that learns from conflict, that we learn how to prevent those harms, and that we grow in understanding. And so essentially our work that we're doing every day, whether we're doing it in our victim offender restoration program, where we're helping those who have harmed and victims come together to sort of understand the impacts of those, to figure out ways to move forward and to make amends for those harms, or when we're at eviction court and we're mediating very intense situations where people are on the verge of losing their home. We are addressing, so every day, that's the kind of work we're doing ultimately, is addressing the health and safety of our community members. And really what we do and the way we do that is we mobilize community volunteers, because a core belief is that all of us together can figure out how we need to improve the way our community operates and how our community can become a safe and nurturing place for everyone. Is that we provide safe space for people to come together to state their challenges, their issues, their positions. We kind of help people take deeper dives to look at what's sort of motivating those decisions. And then hopefully we create this space for people to hear each other, to understand better about what's happening, and then find creative ways to move forward. So our newest initiative, really quickly, Community Voices for Health, is funded by the Robert Wood Johnson Foundation. This project, and we're doing it in partnership with the Bloomington Health Foundation, and we have other local partners, Gnarly Tree Sustainability. I see Stephanie's on the call. IU O'Neill School, Center for Rural Engagement, and a state organization called Accelerate Indiana Municipalities. So the idea is for us to work with our community to find and strengthen ways for our community to come together with decision makers to understand, again, issues that are facing our community, and then together with decision makers, find different ways and more effective ways to address those issues through policy and decision making, practices. So that's it in a nutshell. For the last year and a half, we've met with over 200 people. We've created an advisory council. Part of what we are doing when we're listening to people is and I left out a big focus is to ensure that all people in our community's voices are heard. So we've worked really hard to ensure that underrepresented people, underserved people who often are not at the table when those decisions are being made are at the table, sharing their concerns. We're really listening to what they're having to say. And then we're going to create opportunities this fall to bring many of you, I see decision makers on the call, together to grapple sort of with these issues, understand things deeply, and really hear what's most important to the people in our community. So sorry, that was a lot to say.
No, that was excellent. Thank you so much. It's so great to be able to kind of learn a lot about these sort of participatory, methods of trying to be able to solve community problems in this. And I think it's especially a timely time to be focusing on this. Melissa, your role as a BPD social worker, I'd love to be able to hear, following from that, a little bit about how you kind of see the intersections of health and safety in our community.
Yeah, sure. Again, thanks to everybody who's here this morning. Bright and early, I've seen some community partners of mine on this call, so I'm excited to see you all here. Yeah, I'm Melissa Stone. I have been the social worker for Bloomington Police Department since March of 2019. We just recently hired 2 more, so that's exciting. I'm not alone anymore. But BPD recognized long ago, even 2014 or so, that a lot of the problems that they were facing have that intersection of there's a mental health issue going on, somebody's about to be evicted, or somebody can't get their meds, whatever it is. A lot of calls that come in tend to be those repeat calls of people who aren't getting those basic needs met. So back in 2000, I think it was 14 or so, Chief would have to quote me on that. We would have to give you the actual date. But he started the Downtown Resource Officer program that works specifically with people experiencing homelessness, because we know what's happening is they don't have a stable place to live. They are wondering where their next meal is coming from, those types of things. And they expanded on that in 2019 to include my role. So what I do on a daily basis is I either go on scene with officers when they're like, okay, no crimes committed, but clearly there's something going on. Either it's a mental health issue or an aging issue or something. So they can call us on scene and we go, the officers leave, then we try to figure out what is going on, what's the full story. And what we tend to find is that people have just fallen through the cracks and they're not getting those basic needs met. So a lot of times it's really getting them reconnected to services that they've already had, or getting them into new services that they hadn't had before, whatever that looks like. But we know, and BPD knows, what's happening tends to be outside of what police need to deal with. So we've been able to come in, get people connected to those services that they need, and decrease those calls to the police department. And that was the kind of goal of the program, specifically at first, is to look at those repeat callers. And what we find most of the time is people just don't know how to get somewhere, or they decided to try something different and didn't like it, or whatever it is, and getting them connected. And one thing about our roles is that we don't have to care about somebody's diagnoses. We don't have to care about what their insurance is. We don't have any of that. So we truly get to provide access to care, whatever that looks like, without having to say oh, you can only go to one agency, or whatever that looks like, and really trying to look at all of the options for a person. So we spend a lot of time doing that. And then of course, I don't want to go without saying that we also help our officers and making sure that they have what they need to make sure that they are in the right place when they are responding to calls, when things do happen, because things do happen, bad things do happen. So making sure that our officers are in the best shape as possible as well. So we look at all of those things.
Excellent. Thank you so much. That's super informative. Yeah, so Penny, I'd like to turn to you to talk a little bit about some of the work that you're doing with the health department. Obviously, you're coming off a pretty busy time here, and so a lot of the stuff is fresh on your mind. So I'd love to hear some of your thoughts.
Certainly. Thanks for having me this morning. Thinking about your question, I'm not quite sure where I start with our work in the community after this past year and a half, and probably people's perspective from what the health department does has certainly changed. Public health has been in the limelight in the last year and a half like never before. I came into the position as the administrator in 2008, right before H1N1. So that was my big pandemic experience until now. We've had certainly other outbreaks that we've dealt with, whether it was Hep A or mumps or those kinds of things. But this was certainly one for the record books, if you will. But our our work at the health department is really very broad, and most people prior to the pandemic are probably most used to knowing about us from the forward facing things that we tend to do on an everyday basis, things that are mandated by law, some things that are not necessarily mandated, but they're expected. Preparedness probably is one of those things that comes to mind that was established after 9/11. It was 2004 when that division was really started and funding started becoming available for that. But most people probably think about vital records. They think about their birth and death records, and they think about environmental health side of things, whether it's that they have a septic system, or maybe they have a neighbor who's got a failing septic system that they've had to report, or they think about retail food establishments and food inspections, or they think about radon and those kinds of things. Maybe they think about population health around tobacco education or harm reduction that we work with. But we also have several grants that support our family planning clinic at the health department. We have disease intervention specialists that focus on sexually transmitted infections. We have a partnership with IU Health for public health nursing. So our immunizations, our TB follow-up, our non-STD communicable disease follow-up, because all those reportable infections have to have some sort of follow-up. And so that's just this very broad kind of work that we do every day. Along with that, we deal with preparedness, right? And most days when prior to this, we think about preparedness and we are making plans for the unexpected and the things that we don't think will really happen. And then something like COVID-19 happens and you go, wow, I'm really glad we have that public health preparedness person. I'm glad that we have some plans, even though they are a very, we've had to detour a lot because when you have a pandemic, things change. But the overarching work that we do at the health department is based around the 10 essential services of public health. And those have changed recently in some respects, but the overarching goals are to do assessments. And right now we are in the middle of a community health assessment. CJAM has been a part of that, but we work every time we do these, and they're pretty much on a 3-year cycle. We work with the hospital, we work with the city parks department, and that has just been relationships way back for some of you who may remember Achieve and some of that grant and focus that we had several years ago. We have maintained those partnerships and that work and kind of combined that. So we are right now in the middle of the assessment. There's a survey portion of that, trying to get feedback from individuals. There's focus groups trying to get feedback from individuals. And then once we have all of that information kind of gathered, we will present that. We usually call it a think tank. So I'm going to take this opportunity that when that invite is out and when we let people know, please come and join us at the table. Let others know that it's an opportunity to look at the data, hear it, and then make some decisions for what we as a community need to work on. Because the health department alone, our mission is to protect, promote, and improve the health of all people in Monroe County. But that's a tall mission, and it's one we can't do alone. The public health system is made up of many entities, with the health department just kind of being much of the time in the middle and being a partner. And that takes us to our vision, which is leading and partnering in creating a healthier and safer Monroe County. So it takes all of us together. So we will be presenting that information probably this we're in the middle of summer, so time goes by really quickly, but I'm going to say this fall, some of that will probably coincide with the work that CJAM is doing, and they will be very much parallel to one another, and I think feed into one another, but just don't confuse that you have two opportunities, not just one, to give your input on where we might go in the next few years as we look at what strategies and how can we make this a safe and healthy place for our residents.
Thank you so much, Penny. I put a link right there in the chat to the community health needs assessment for 2021. And so this is a really good opportunity for folks here when I think one of the first things that we can do, since we have so many people who are here who are looking for community input, and we're here right now, so we have opportunities to be able to provide input into all of these really, really important matters related to community health. You know, one of the things that, I'm listening to throughout this conversation is that, we've tended to be able to think about a lot of separate issues as piecemeal, right? Public safety is its own problem, the addiction is its own problem, housing is its own problem, and other health outcomes is its own problem. And so what I'm hearing from all of you is that, these are problems that all touch one another, right? It's like we can't necessarily just deal with one issue. We have to be able to look at the ways in which all of them intersect with one another. And so from your opinion, one of the things I'd like to get a sense of, do you have a sense that, like, there are particular hierarchies of issues? I know that you're still collecting a lot of information, but is it a matter of, like, we need to be able to solve this public health stuff in order to be able to properly do safety, or is it a matter of just kind of all working in all of them in harmony? So I'd really be curious to get some of your perspectives on this.
Well, from the health department standpoint, and I would go back to those 10 essential services assessment policy development, that kind of goes to exactly what Liz was talking about, and assurance. And one of the big changes and focus now on the 10 essential services, the basic components haven't changed, but how we look at them has changed. And that core center is equity. So how can we make sure that everyone has sort of that equal access to what they need to have a safe and healthy community? I like their part of that is everyone should have a fair and just opportunity to achieve good health and well-being. And certainly good health and well-being varies. It's kind of the lens that you're looking through. So we have to keep that in mind, and that's why we need everybody at the table. But it's also includes, when we look at our mission for all people in Monroe County, that was intentional, because it's not just about our residents or the people who have residency in Monroe County. It is about all people. It's about our visitors. It's about our temporary residents. It's about our permanent residents. It's about individuals, whether you own or rent or don't have a home. It's whether you use drugs, you don't use drugs. It is encompassing everybody. And I don't think that we can fully separate health and safety. Certainly, we can address individual things, but the root cause of most of these is people's basic needs not being met. And every time we do a health assessment, and this one as well, there's not a lot of changes in terms of what are people most concerned about. Basic needs, that is always at the top of the list. Food, shelter, safety. How can I focus on my physical health if I don't know if I'm going to eat today, what I'm going to eat, if I don't know where I'm going to sleep tonight, and wherever that is, am I going to feel safe while I'm sleeping? So I might feel safer on the street than in somebody's house. It might be, I might feel safer in someone's home as opposed to the street. And that's going to depend on that individual and their situation.
I'd like to build on what Penny is talking about too, to sort of talk about sort of a couple of the specific focuses of this community voices for health. So part of what we're trying to do is create pathways to ensure consistent, authentic voice for all. So how do we do that more effectively? So oftentimes when we do these kind of health needs assessment and you look at the data and who fills out the surveys, it's, middle-aged white women, that are very active and well-educated and fairly high, higher income. So part of what we've been trying to really intentionally work at is identifying the groups of people whose voices aren't normally represented, and to hear from them and to hear from them. So we don't say which problems are the most important to you. We ask them 3 questions. What is important to you about your health? What contributes to your health? Like where you live and where you spend your time. So thinking broadly, what contributes, and what would you like leaders and decision makers to know, that, and how might they help? Because then the second thing that we're really looking at, and again, is for helping, part of our project that we're going to be focusing on going forward this fall, is to doing deeper dives with decision makers to understand how they're taking in voice, how they're making decisions, and what Penny said, understanding how health is underpinning all the decisions. So one of the examples of things that we've been doing research on is looking at other communities that have implemented health in all, or a health element in comprehensive planning that both counties and cities have to do on a regular basis. There's another initiative that a lot of communities have started to implement called Health in All Policies. So it's at that policy level, how are people thinking about those decisions that they're making, and how is it going to impact people and impact equitably so that everyone is impacted, in positive ways, if that makes sense.
Yeah, it's interesting. Health in all policies. That's a fascinating way to think about the integration of health into the broader public policy arena. Melissa, do you have anything to add?
Hard to follow on that, except for I agree. You cannot just look at public safety. You cannot just look at mental illness or substance use. It all ties in together. Of course, as a social worker, I work on what the client wants to work on first, but really, we know that it interacts all together. We have some great community partners. We have some great organizations in Bloomington and Monroe County, some fantastic organizations. So I know that I can't do the work that I do without them. And although things can be very siloed, and there are a lot of reasons for that, I've been so fortunate in this role in that I have people all across the board who are willing to assist with people, excuse me, whenever they need something, with my clients, with whoever. And I just want to say I'm so fortunate, and we are fortunate in the community for the partners, but it does take all of us willing to work together to make these types of things happen for people.
One of the things that I think, Melissa, that you said that is sort of bearing up with some of the research that we're hearing, some of the stories and things that we're hearing from the participants in our small group discussions, is that idea. I loved it when you said, I don't have to see the person as a diagnosis. I can see them as a person. And what you were just explaining is so important, because for many of people, underrepresented people oftentimes they feel less than whole. So some of the people in the disabilities community talked about feeling like maybe their needs are not, they feel as if their needs are not as taken as seriously as able-bodied people, or people of color talking about their fear in just exercising, and going out into our parks and having this element there always in the back of their minds. And the same for LGBTQ and transgendered folks. A lot of of issues on safety and trauma and their experiences with other of not being treated well. So I love that you were saying that. And I love the work that you are doing every day is incredible. And it really is building that bridge to trying to, in a very intense situation, get people pointed in the right direction, avoiding arrests and those other things that can happen. And I know how much you work to de-escalate those conflict situations.
Yeah, it's fascinating to observe the ways that equity lens has been really taken on and taken seriously by the public health community, and how much it's affecting our thinking about issues of public health and what it means to actually be in a safe and healthy community. And so this is really appreciate all the work that people on this call are doing. We do have a couple of questions that are here in the chat that I would love to be able to get to, and we got a couple from Catherine Wilson, and I want and Penny, this might be more up your alley, but I think if anyone else has anyone to offer, they might be able to do so. What do you do to help people introduce care for elderly parents? For example, do you have a list of specialists for the elderly that have been affected by COVID-19? And also as a question on financial advisory and legal help for Medicare assistance for the elderly. So is this something that you have any experience with and insights into?
Yeah, it isn't something that the health department directly does. Certainly there are portions of IU Health, for example, that deals with memory care and memory issues and can provide linkages to those specialists and care. Certainly it is a concern, and COVID-19 has, even in our assessment, looking at just some of the preliminary data, what's been the most stressful thing? It's kind of been COVID-19 and work has changed because of COVID-19. So many people have lost employment, those kinds of things. Talking about elderly parents, there are lots of people who are, I'm in that sandwich generation. You have your children and you're taking care of your parents as well. So IU Health does have, and I think it's Dana Thompson, if I'm remembering my name right, these moments, I always am afraid that I'm gonna spill out the wrong name, but she would be my first contact for the answer to that question. And she is with IU Health.
I want to jump in on that too. I see this a lot, and I work a lot with clients who are kind of on that line of, should they still be at home by themselves, or should they start going inside of assisted living type category? And those are really tough conversations to have. And sometimes it comes off better when it's from somebody who's not their family member. So I do have a lot of times where I build relationships with elderly clients while we're working on that long-term plan and what that looks like. So I will visit them. We do lots of follow-ups, go once or twice a week sometimes, and just kind of build that relationship to help those people have those conversations with their parents. Dana's a great one. I would also say, even with disabilities, I think you mentioned disabilities in your question too. Area 10, they're fantastic. And that's a great list. And part of what we do too is, I'm not just going to tell somebody like, oh, go to Area 10. I love Area 10. I'm going to make sure I follow up with that person and make sure those connections are made and make sure that you're getting all those needs met. So that's kind of a pro to our role too, is that, we don't have to just send you off and not follow up. So we do a lot of that within this too, but I definitely wanted to mention Area 10 for the fantastic work that they do. I'm pretty sure I call them every day. So they're great.
I am glad you mentioned Area 10, because as you were talking, I'm like, oh, Area 10. And just from a very personal perspective, they were very helpful with us as a family. And you are absolutely right that an outside person, and this happens in all kinds of things, right? I can remember with issues with my own family where I could say, my dad was having health issues, and I could say, Dad, you know, this, and it was nothing until the home health nurse came in and said, you know, you ought to do this. And the nurse said, I'm like, huh, I don't know where that may have been said before. So you are absolutely right that sometimes that outside person is much easier to hear it from than a family member.
Well, and also that's another service, you know, talking about our mediation for CJAM, we do want people to know that we help families mediate those kind of situations. So it's kind of a term we call internally elder mediation, where you bring family members, you can bring the caretakers, you can bring, you know, attorneys that might be working with the family, but really together to really in a neutral, again, safe space to have a discussion, and again, centering that elder person as the focus for that discussion so that everyone's participating together. And a lot of times in those family kinds of disputes, kids in the family end up acting kind of reverting to how they all interacted when they were children. And a lot of issues can get in the way, and oftentimes it's that elder person whose needs really are not being met. So I echo that. The other thing, and I don't know, Jen, if you could put in the chat, I sent you, Jen Caudill, links to a couple of forms that we're calling our Share Your Story, because some of the questions that I'm seeing in the Q&A, and even this question mark that you posed, does have elements of sort of policy issues that, you know, where families are and when they can afford what, and what happens when the elder person has to go. And so this link to is, again, your opportunity to give us your experiences and your feelings in that area, for instance, of elder issues or memory issues. And so the more that we can hear specifically what people are dealing with, the better for our community.
Excellent. And it looks like Jen has shared all of that information in the chat. And this is, yeah, so this is an excellent resource. This is our ways that direct following this call that you can be able to provide your inputs, which is certainly going to be relevant to policymakers. It's going to be relevant to all of those who wish to have the most rounded information as possible about how to improve community health. And I think that this is wonderful. And there's forms both there in English and Spanish. And like always, we'll also be sending out links afterwards, you know, and so I think that people who need to be able to find out more about Area 10 and all of the different organizations that are involved will be able to provide those resources so that people can engage appropriately. I have a question as well from Ann Bright. This one is directed toward Melissa. Melissa, do many people you encounter need emergency shelter? Do you feel we have adequate emergency shelter? In regard to people falling through the cracks, do you find people say they have case managers and local agencies but aren't in contact with them?
Great questions, Anne. Yes, a lot of people we run into are seeking some sort of emergency housing. They are kicked out from a place, they are evicted or going to be evicted or something like that. I mean, the short answer is no. Like if somebody comes to me and they're like, I'm evicted tomorrow, I have a few options for them in terms of shelters, but it takes a while to get something that's more permanent. So the process can be very long, and it just makes me so sad every time where I'm just like, well, like we might only have like shelter options for right now. Now we have some really great shelter partners here in the county, and most of the time, very rarely do I hear that there are no beds at all. But what we tend to find, and I don't blame people, I mean, if they're a couple without kids, then they have to separate, and people don't really want to do that because, I mean, they survive with each other, and I can definitely understand what that looks like. So I don't want to say like, no, we don't have enough like emergency housing, because we have some really great shelters, but those shelters don't always meet the needs of the people that we have with pets or a partner or whatever that looks like. So yes and no, I guess. And then in terms of people falling through the cracks, sometimes yes, sometimes it's, you know, most of the time we hear, yeah, I had a case manager, or I had somebody at this agency or whatever. And it kind of goes back to those restrictions that are put on other agencies. So Centerstone, our community mental health area agency here, that is extremely difficult work. It is super difficult work because the cycle of mental illness is that people engage and then they don't. And then if people don't for long enough, unfortunately, there are Medicaid rules that require X, Y, and Z to take place. So they have to close their case if they miss so many whatevers. And doctors' offices do this too. So it's not necessarily on the individual per se, but it's just the cycle of mental illness and what that looks like. So a lot of times it's just getting that restarted again. But then we do have a lot of people who, I mean, we're in a college town. First time psychotic breaks happen in that college age range a lot of times. So we have tons of people who are experiencing these things for the first time. And they just, if they do kind of well, you know, they're okay in classes, they're okay at work, but you don't really notice it until it's full blown. And then it's difficult to get people connected to services at times when they're extremely paranoid and things like that. So we have a lot of like first time things as well, but most of the time the falling through the cracks is just because of things way out of anybody's control here. And that's why I'm so glad to hear, Liz, that you guys are doing some policy, big picture, statewide, nationwide, whatever things, because so much of the work that happens here is affected by the laws that are already in place. So it definitely takes more than just what we're doing here in our community.
Mhm.
And I think a lot of what we're hearing from the participants is those issues with navigating systems, just like what you were talking about, and the need for more coordinated, I think to your point, Anne, or to your question, more coordinated, maybe case managers, navigators, housing navigators, mental health navigators, getting signed up for Medicare, Medicaid, disability. So I think those are some of the experiences that we're hearing over and over by different groups of folks, maybe impacted a little bit differently, but the essential issue is I'm in trauma, I'm in stress, I have these issues, and just trying to get help to deal with these adds another layer of trauma. That sometimes is worse than what they might be dealing with, even currently with the issues that they're dealing with. So love that you said that. So Melissa, how has the Stride Center impacted your work out on the streets? And can you tell us a little bit about that?
Yeah, so Stride has been a resource for police officers to take people who don't need to go to the hospital, who don't need to go to jail, but need a place to go for whatever reason, for access to services. And it's been a really good resource for our officers. I mean, I've taken a few people there. Sometimes I personally feel guilty to just drop them off and leave them because I'm a social worker, so it feels a little bit different for me. But when I hear officers talk about it, you know, it's really helpful for them in the moment. There was a disagreement, something happened at a house, somebody had to leave because they're not on the lease or whatever. And it's like, well, what do we do with them while they wait on whatever's next? And Stride has been that place where you can take people there, and there are people there, professionals there who can help navigate those next steps. So it's been a really good place for our officers when there are no other options for people. It's good to have that in the back pocket. And they've been really great partners with us. So we've enjoyed growing that. Of course, it's new and people are still, it's voluntary. So officers can just say, hey, what about Stride, and like sell it, but it's still voluntary on that person's behalf. So we're still trying to grow what that looks like and how it can be helpful, and like not make it to be too fearful of going to something like that. But we are excited to like have that partnership here. It's a good resource.
And if I can, I would just add, I think that that is a good example. The Stride Center is a good example of what can come out of coalitions and lots of different people coming together, because the Stride Coalition certainly has lots of different people at the table representing the community, and really looking at what are the needs and why are people, you know, going to jail, perhaps that don't need to go to jail. That's not the issue. You know, it is, there's a different root cause, and providing that other opportunity. Because unfortunately, law enforcement sometimes they before Stride, they only had, you know, this jail or the hospital. I had to do something with this person now. And to be able to have other options. And I think, again, having Melissa, you know, having you there, and that's another option, right? And because we have put a lot on, I think, our law enforcement and public safety folks that's outside of that true scope of what they're intended to do. And we want to meet people again where they are. You've said that, and meet the needs that they have. So I applaud your efforts, and I think the Stride Center again is a great example of what can come out of a coalition really working together and looking at root causes.
Yeah, I think that this is really fascinating to learn about all of these collaborative approaches here and the participatory framework for addressing core policy problems. I want to go to a question as Charlotte Zillow has a question for us on how do you work with providers to make sure they deal with clients understandingly and respectively as they might with paying families?
One thing I guess I would challenge all of us on this call to think about is how can we begin to work on that issue? Because again, that's some of the concerns that we've been hearing from people, feeling like there is an unequitable healthcare system and those different ways that they are treated. So I think that to me is some of the work that we want to be taking deeper dives at, and then thinking collaboratively and collectively, as Penny just said, to figure out how we can address some of those, and maybe in a way those are sort of implicit biases, going back to that equity lens, that people don't even understand how their actions are being perceived, and getting them thinking more deeply. So I don't have an answer, Charlotte. It's a great question.
Yeah, me either. I'm sitting here thinking about, well, how do we really do that? And again, IU Health, since many of our providers in the community are part of IU Health, I can't speak for them. I do think that they, like many other businesses, are looking at how we look at implicit bias, what education we're giving to our employees to kind of reframe those things. On a higher level, I would hope that as we look at medical school or any of our School of Public Health, as we look at any kind of education, that those things are included in it, not just healthcare providers, but certainly for medical school, it should be a part of that curriculum.
I think, well, again, this kind of goes back to like a big policy thing, because I'm sure there are plenty of doctors who would want to treat all of those people, but insurance. And insurance is just going to, right now, the way it is set up, going to be that barrier for people. We have great resources in town like HealthNet for people, and the people who work there, the doctors, the social workers, everybody are fantastic. But there is going to be that barrier. I think it's part of our role too, when we do interact with people. This happens a lot, where I go to an appointment with them, or I get on the phone with them to help them advocate for themselves. And those are important roles that we need to have in the community as well. Just to, I mean, it's unfortunate that sometimes it takes that, but at the same time, like, we're more than willing to be able to do that. So really just making sure we have the people in place too to really help people like find their own voice and help advocate for them and like be there for them too.
Yeah, I like
We
this.
have,
Oh, go ahead.
sorry. I was just gonna say, maybe we do have an opportunity with the new hospital and with IU Health and how we can engage with IU Health more fully in our community. They're very active from their community health perspective, but there might be an opportunity because I think the new hospital is going to have sort of a teaching lens, correct, Penny? Is that right? Do I understand that? So there's a great opportunity that maybe some of this work that we're doing can filter up to those folks, and we can really engage actively ourselves here with med students.
Yeah, I think this is a really fascinating discussion just because I think it shows kind of like the equity work, has a policy dimension. It's one of those things that we need to rely on decision makers and build the civic infrastructure in order to be able to achieve equitable outcomes. But there's also the internal work of recognizing the equality of dignity, and that's another thing that this is trying to get at, is challenging ourselves. We understand like how we're relating to other people and how we're ensuring that our own implicit biases aren't resulting in worse outcomes for some people than it might be for others. And I think that this discussion is so critical to it. And I think it also goes right into the important work of collecting public information that the folks here on this call are doing. We're getting close to the end of the time. However, I do have a couple of questions. I want to see if we can get to Councillor Piedmont Smith has a question. This is probably going to be up Liz's alley, but we'll allow anyone to respond to you. Do any of you work with people who are unhoused on conflict remediation and improving their own safety?
I could not quite understand what you said. Could you repeat the question?
So the question is, do any of you work with people who are unhoused on conflict remediation? And it says, comma, improving their own safety, I guess, on improving their own safety.
If certainly in mediation, that could be one of, if CJAM was involved in mediating some sort of dispute that were, say, for instance, between unhoused people, part of what we would want them to be looking at and thinking about is, those plans, one dealing with the conflict, but also getting them thinking about what they could be doing. So kind of creating this personal plan, or using a restorative justice lens of sort of thinking through what responsibility they have and how they can help themselves be more safe. But maybe Melissa, do you?
Yeah, I think that happens all the time on a day-to-day basis with all kinds of organizations in the community. So I mean, Beacon, Outreach from Centerstone, ourselves, we build relationships with all different types of populations. So sometimes it's just a direct call to us to be like, this and this is going on with so and so, and we know them, and we can mediate that before it becomes a bigger issue. So I think that does happen all the time, and with all populations, really. Once you have that relationship built up and put in the work, to build those relationships, we get those phone calls and can actively do those, as well as our downtown resource officers do a lot of that too.
Excellent. Thank you. And I got a question from Iris Kiesling here. And the question is, if we don't have a doctor or a provider, what is or how can I have a point of entry?
And I guess my question is a point of entry into which service, right? So one, I would say if someone doesn't have a provider right now, I would certainly say HealthNet is a good place. That would be my first referral. And because if you don't have insurance, it's okay. They can see you, they can work with you on getting that. So that would be my first referral and linkage to care in that respect. We do have, and it's just a few hours a week, we have, as part of our family planning clinic, a certified insurance navigator. And their intent, obviously, is to help our clients or people who want our family planning services who don't have coverage to be able to find it and find something that meets their needs. But if there is someone that needs some help with navigating that and they have an appointment slot, we will certainly accommodate people who are outside of the clinic. Again, they're just here a few hours each week, so the time is limited.
All right. We're about the end of our time. If does anyone have a final last words, if we can keep that to about like a sentence of what message do you have for our attendees today on how they can be involved in the effort to improve broad community health outcomes? If each of you has a sentence that you want to provide.
I guess the one thing that I would say is to participate, to share your thoughts and your experiences so that they are considered and included in the health assessment, in CJAN's work, in everything that is going on. Because if we don't hear those stories, then they're not included. And Liz is absolutely right about the majority of people who fill out the surveys are higher education, higher income, and so forth. So we want to hear from a wide range of people. So please share.
And I just want to do a plug. We have our 2 first community-wide sessions where we want decision policymakers and the people that have been involved and anyone from the community to attend. One is it's in the chat, but Sunday, August 29th from 3 to 5, we'll be sending out the Eventbrite site is not quite up. It'll be up, I think, this week. And then Tuesday, September 14th is a Zoom meeting. The Sunday one is an in-person meeting that'll be at the library. So please, please spread the word and participate. Thanks.
Excellent.
So much for this opportunity. Enjoyed it and learned a lot from Penny and Melissa.
Yeah, and real quick, I guess I will just add up by saying, I would always say like 85–90% of my job is just listening to people, and a lot of stuff doesn't necessarily get resolved, but definitely calms down just by listening. So be a person who's ready to hear that out, no matter how long it takes. And also, I mean, educate yourself on some of the resources that are out there. I mean, there's so many, but if you have an idea of where to send people and how you can help get them connected from the beginning, then you're gonna really help people get into stuff faster, because a lot of stuff there are wait lists. So the quicker, the better.
Excellent, excellent, wonderful. Well, thank you all, Melissa, Liz, Penny, for such a fantastic presentation of your ideas. I have learned a whole lot, and I know a lot of our attendees have as well. Please join us again next month. And I want to once again thank our 2021 sponsors, the Bloomington Township IU Credit Union, Community Foundation of Bloomington and Monroe County, Duke Energy, and Old National Bank. The next month is going to be August 10th, and it is Building a Better Normal, United Against Hunger. The link is right there in the chat, so feel free to use this occasion to be able to sign up Thanks again to everyone for coming and participating, for spending your morning with us to learn more about these issues. And thanks again to Melissa, Liz, and Penny. Certainly an enlightening conversation. And I know that we have a lot to move on for here. And I wish you all well and the best of luck in the work that you're doing.
Thanks. Have a good day.
Thank you.